So we're doing our pre-shift checks and we're just making sure that the oxygen is ready to go. We can tell that this is an oxygen canister because it's white and it's got a black top and has oxygen written on the side. With our regulator, we check that the Botox seal is intact and we make sure that it's able to regulate the oxygen flow adequately. We do this by turning on the oxygen flow and making sure that it regulates it at different rates, which it does. And now we will bleed the air by turning it off and bleeding the air, and the air is bled and I'm happy for that to go. To enter manual mode, turn off advisory and enter manual mode. To change the lead size, you select lead and you just change the lead size. To change the size, just enter the size and change the size. To enter AED, advisory
Push,
and analyze.
Analyzing
And it
now.
will automatically
Stand
analyze
clear.
the patient.
No shock advised. Start sequence.
So we'll turn off that and we'll go back and we'll change the volume of the heart rate monitor. And to do a test load, we will charge it up. We will select the energy and we'll charge it up. And it will just dump it into the test load that we have on the right hand side. To dump it into the test load, just push shock. However, to cancel a charged defibrillator, or to disarm it rather, you just need to push this middle button in here and it'll say it's disarming. To perform a user test, select options, select user test, and it'll run a user test, and it will also test the printer while it's at it because it will print out a passed user test. Right, this is our first response kit. Here we have our vital equipment with blood pressure cuff for adult and children, pupil torch, thermometer, stethoscope, BGL kit and clothing shears. Across here we have our glucose sachets, glucose, glucagon and a syringe. Over here we have an emesis bag, spinal lanyard and ethyl chloride. Over on the other side we have our hemorrhage control kit with tourniquet, bandages, gauze, stereo strips and saline. Over here we have our medications which are all up to date. We have our OPAs and NPAs and our laryngoscope, as well as a biohazard container. We have oxygen tubing, we have more medications, again the medications are up to date. In the middle we have our IVs, we have saline, we have our C-collar, splint, we have our bag valve mask, and we also have one for a pediatric patient. We have a sharps container, we have medical pouch, and we have more towels, and that's our first response kit. So here we have our suction unit. I'll just be checking for any damages to the piping, as in holes or anything like that. As there's not, I'm going to perform a user test, turning the pressure up and holding test, including the pipe. Indications as to when to use this would be if there's any blockage that could interfere with airflow, and that is reachable by the suction unit. The pressure is all the way up at max and the battery is on level 3. The way that you would use the suction unit is by having the patient in a lateral position, going only as far as you can see, only holding down the hole when you want it to suck and sucking in a circular motion on the way out for a maximum of 10 seconds. Some issues that can occur is you can cause hypoxia for the patient as well as induced vomiting, along with bradycardia, laryngospasms and damage to soft tissue. Responding to a cardiac arrest patient in his residential address, I've established with my off-sider that he'll grab the airway management equipment while I start with compressions. For the purpose of this video, this is an O2 bottle. Hello sir, you alright? Can you say something for me please? Hold my hand. Alright. It's not responding to pain. I'm just checking his airways for any obstructions. I cannot see. Checking his breathing for 10 seconds, just checking for any chest rise or hearing anything.
here, I see either. I'm going to start with compressions. Can you please set up the AED?
Sure.
What's the flow rate of the BVM?
Analyzing heart rhythm.
You tell me.
Do not touch the
Can you set
patient.
up to be 15, please?
Sure.
Shock advised.
15.
Charging. Stay clear of patient. Deliver
Everyone
shock
clear?
now. Press shock deliver.
Brilliant.
Pause. Start CPR.
So we're doing a ratio of 30 to 2. I'll count you down to 30. 25, 26, 27, 28, 29, 30. Can you count me on the next one?
Sure.
After this one, can you please call for an R50 backup?
5, 6, 7, 28, 29, 30. Calling for backup. Backup is on its way.
Very good. So I've selected a flow rate of 15 for the bag valve mask, just so that it properly perfuses the bag, and we get enough oxygen to the patient's lungs. It's indicated because he cannot manage his own airways, because he's in cardiac arrest. Just making sure my offside is using the correct technique for the bag valve mask, because the complication is air entering the stomach and dilating out. So on the next AED shock, I'll go around on the inside. Can you please go around on the outside? Just so we can get back onto compressions as soon as we can.
Stop CPR. Analyzing heart rhythm. Stay clear of patient. Analyzing heart rhythm. No shock advised. Pause. If needed, start CPR.
Off we go. So I'll be inserting a OPA. The way we measure this is from the mouth to the corner of the mandible. We insert upright and then rotate 180 degrees. The MPA, we lube it up and we insert very gently as to not, it does a little damage to the nasal cavity as we can. Tell me when you get to 30.
Whenever you're ready.
Alright, 3, 2, 1. Some indications or some issues that can occur with using an OPA, if it's too long, is laryngospasm, bronchospasm. If it's too short, the tongue can fall back and occlude the airway. So that's why I've also inserted a NPA. Some problems with the use of an NPA is if it's too long, it can reach into the trachea, and if it's too short, then you also don't get proper airway management. Some a contraindication for using an NPA is head trauma, because the NPA can actually protrude into the patient's skull. didn't talk about this in my Resus video, but this is a NPA, and the way you measure it is from the tip of the nose to the corner of the mandible. That's about fucking it.